Rebecca Trimber. Hello everyone, I'm Becca, and today we are going to be talking about Lyme disease. It is an inflammatory disease that is caused by a bacterial infection. This is a vector-borne bacteria that is carried by the black-legged tick, and then that tick bites a person, and that bacteria is introduced into that person's system. There are 3 stages of Lyme disease. The first one is localized, and that is denoted by what they call a bullseye rash around the site of the bite and some localized swelling. The bullseye rash is extremely distinctive. It is a red circle right around the center of the bite. There is a ring of normal skin around that circle, and then another ring of rash skin around that. The second stage of Lyme disease is early disseminated Lyme disease, and this you can see an escalation in signs and symptoms during this stage. So this is going to include fever, headaches, joint swelling, stiffness, and pain. It can also include swollen lymph nodes, basically flu-like symptoms. So when people get into this stage, they often don't think about it being Lyme disease, but they think they have a virus instead. The third stage is late disseminated Lyme disease, and this is denoted by widespread rashes, not around the source of the bite, but all over the body. It can lead to neck stiffness and soreness and unable to move your neck left to right. It can also include facial droop, which can mimic strokes or Bell's palsy. Now, for Lyme disease, it has 2 mimickers that are often misdiagnosed before they diagnose Lyme disease, and that is lupus and rheumatoid arthritis. Knowing about the joint stiffness and pain, you can see why it falls into the articular inflammatory syndromes. Now, for diagnosis, often in the first stage, the localized stage of Lyme disease, doctors will visually inspect the patient. They will look for that bullseye rash around a bite, and then they will ask some diagnostic questions. They will ask about the patient's history to see if they have been in the woods recently, if they've been anywhere that they could have met a tick, or if they saw a tick on their body, maybe it had already bitten and then was starting to crawl off, if they had been in any kind of high vegetation areas that would put them at risk of getting a tick bite that could risk Lyme disease for them. Sometimes, if they are able to see the bullseye rash, doctors will go ahead and start treatment for Lyme disease at this time. However, the most definitive diagnostic for Lyme disease is going to be a blood test. Now, for this blood test, you need to do 2 off of the same vial. The first one is the enzyme-linked immunosorbent assay, or ELISA, and the immunoblot. You need both positives for you to be considered positive for Lyme disease. And these are looking for the presence of antibodies, specifically, both tests, but you do need a positive for both to get a diagnosis of Lyme disease in the later disseminated Lyme disease stages. Now, if you catch it early, a lot of doctors are able to prescribe just a few weeks of antibiotics. So say in stage 1, they see the bullseye, they will go ahead and prescribe just normal antibiotics, and that early stage of Lyme disease usually runs its course in 2 to 4 weeks after treatment. In later stages, there could be months of antibiotics to get rid of this Lyme disease. Now, there are complications that can arise with Lyme disease, like Lyme arthritis, which is long-term joint pain and stiffness. Again, it can mimic rheumatoid arthritis. You can also have Lyme carditis, which can cause swelling around the heart or of the heart muscles. It can cause infection. It can cause dysrhythmias. So you can see as your life progresses how that could lead to even further complications. And you can also get neck stiffness. It can mimic and often lead to meningitis, encephalopathy, so water on your brain. It can do other neurological issues like memory loss, difficulty speaking. It can be difficulty concentrating. and then it can lead to permanent damage on your joints and of other tissues. So it's very important to get Lyme disease diagnosed quickly and to get on those antibiotics, because the longer and further you let Lyme disease be housed in your body in those later stages, the more likely you are to develop these kinds of complications. The prognosis of Lyme disease, as I said before, for early diagnosis is pretty good. It's usually just 2 to 4 weeks. And after those antibiotics, the person fully recovers. They usually don't have any kind of long-term effects, but there are 2 categories where Lyme disease can fall into, where you do see those long-term effects on the body. So that first one is post-treatment Lyme disease syndrome, and you can have fever, headaches, achiness, muscle fatigue, and general fatigue. And all these symptoms are seen without that infection still being present in the body. So you have been cured of the infection, the bacterial infection is gone, but just like we are seeing forms of long COVID currently, so you get the virus of COVID, but you're still seeing that cough for months and months after, even after your body has gotten rid of the viral infection. You can also see that from Lyme disease, where the infection is gone, but the symptoms still linger. And there really is no cure for that. It's just symptoms that need to be managed. There is also another category, which is chronic Lyme disease, where you see all the same symptoms, but you still have the infection. And it's just another treatment of antibiotics on that, and that's where you see the long-term antibiotic use of months and months and months. Overall, this is a very treatable condition for most people, but you have to be made aware soon, go to the doctor, and it does need treatment.